Hey team, this afternoon we're going to talk about cardiac point of care ultrasound. I know that this is what you've all been waiting for, so let's get in and let's really get to the heart of the matter. Bad pun, yes. So the first rule with cardiac ultrasound is probe marker location, probe marker location, probe marker location. You'll see here designated by this nice bright big red arrow that the probe marker is actually on the right side of the screen. So that is different than what we went over in the ultrasound orientation, and it's different than literally every other ultrasound you will ever do. But cardiac imaging takes place with the probe marker on the patient's right. So that's our first rule. Pay attention to that and always make sure that if you're doing cardiac that the probe marker is on the right side of the screen, and make sure that you are adjusting. So let's get oriented. We have our stick man here and his heart. We have the base of the heart, then the apex, which is that nice little point of the heart. We all know where our probe marker is on the probe, and then we know that we're in our cardiac orientation because we are looking at the probe marker on the right side of the screen. So when we're looking at the heart, we know the base of the heart lies closer to the patient's right side, and then their apex lies over to their PMI. So just remember that, because we might talk about fanning the probe towards the base or towards the apex or sliding the probe. So you'll need to know the location of the heart and the base versus the apex. So what are our four cardinal views with point of care cardiac echo? Our first view is our parasternal long axis. Our second view is our parasternal short axis. Our third view, apical foreview, and then finally we have our subcostal view. The thing I love about each of these names is that they tell you exactly where you're supposed to place your probe. So in our parasternal short and long axis, we are placing our probe on the patient's left, but right next to the sternum. Start about the third intercostal space, and you might have to scan more cephalad or scan more caudal in order to really visualize the heart. Don't be afraid to move the probe up and down. Just slide the probe to see where you're best imaging the heart. Then our apical foreview is right at the fourth intercostal space around the nipple area. Think about where you would locate your PMI, and that's normally the location of your apical foreview. Then our subcostal view, also known as our subxiphoid view, is located just up underneath either the xiphoid process or your costal margin. So our views, we're imaging in the long axis of the heart in our parasternal long axis. We're imaging in the short axis of the heart, goes without saying, in our short axis. Then the apical four is going to be a four-chamber view in which we're looking at all four chambers of the heart. And our subcostal view is also a four-chamber view as well. The thing you want to ask yourself is, where does my beam hit first? So we know that the first thing the beam hits, it's what's going to be at the top of the ultrasound screen. So when we're looking at our parasternal long axis, we have the probe marker. It's pointing to about 10:30 or the patient's right shoulder. And that's really important to remember where your probe marker is pointing for each of these axes. So parasternal long axis, I'm starting with the probe marker at around 10 or 10:30, patient's probe marker towards the right shoulder, and trying to get the best image. I might have to adjust between 10 and 11 o'clock, but I'm trying to get an image that looks like this. At the very top of the screen, so the most anterior chamber of the heart, I'm seeing the right ventricle. Then as we go down, I'm seeing the left ventricle, which is a larger chamber, the aortic outflow tract, the left atrium. I'm seeing the mitral valve. This bright white line beneath the left ventricle is the pericardium. And then I'm seeing the descending aorta. And I want to make sure that I have enough depth to see the descending aorta. So if we are looking at our parasternal long axis, the one thing we want to look for is that the RV, so the right ventricle, the aortic outflow tract, and the left atrium should all be 1:1:1. And always make sure that we have enough depth to see the descending aorta and the pericardium. To get our parasternal short axis, we're going to rotate the probe 90 degrees clockwise so that now our probe marker is pointing to the patient's left shoulder, but really more about 12:30 or 1. So not quite all the way to their left shoulder. We're seeing the left ventricle. It looks more like a nice big donut or bagel, and the right ventricle wraps around it like it's a croissant, just in case you're hungry right now. In our parasternal short axis, we can fan and get different cuts of the heart in the short axis. We can fan and we can look at the right ventricle. We can look at what we call the aortic level, where we're seeing the aortic valve, and we're seeing 3 leaflets here. We can fan until we see the mitral valve level and see the 2 leaflets of the mitral valve opening and closing, usually like a largemouth bass. And then we can fan down till we see the parasternal short axis at the level of the papillary muscles, which is our third image at the bottom right of the screen. So we're seeing those papillary muscles, which are going to be pulling in the left ventricle. Then we go to our apical foreview. So this is a view which we're getting right about the PMI, or the apex of the heart, about the 4th intercostal space. If the patient has EKG leads on, this is usually where lead V4 is located. And with this one, it's really critical that we make sure we have the right orientation. So we see our probe marker is still on the right side of the screen. So now we're turning the probe marker until it's pointing to 3 o'clock. So as we are scanning down and going to the apex of the heart, the probe marker is going to be pointing towards the bed, or about 3 o'clock. And this is important because we want to make sure we do not get our right ventricle and our left ventricle mixed up or confused. So now, if we have our proper orientation for the apical forward chamber, we have our right ventricle on the left side of the screen, the left ventricle on the right side of the screen. Then we're able to see the right atrium and the left atrium. And you can see that here. We can see the right ventricle, which should be about 2/3 the size of the left ventricle. They also have distinct shapes in a normal heart. The right ventricle has a nice horn shape, and the left ventricle is more of a bullet shape. We're also want to make sure that we're seeing the left atrium and right atrium as well. Our final view is going to be our subcostal view. So now we're moving the probe underneath the xiphoid process, or underneath the right costal margin. Why did I say right costal margin if the part's on the left of the patient? Well, if we're having a lot of interference from an air-filled stomach when looking up underneath the xiphoid process, we can just slide our hand to the patient's right and use more of that liver as a window in order to image the heart. So this is a little bit backwards, if you will. We'll have our feet at the top of the screen, kind of head at the bottom of the screen, and then we'll have our left side on the right of the screen and our right side on the left of the screen. So the ultrasound beam as it comes through, and I remember for this one, our ultrasound indicator is pointing to about 3:30 or 4 o'clock. So over to the patient's left. The ultrasound beam is going to come through the liver, and then the first chamber it's going to hit is the right ventricle. So look for the right ventricle at the top of the screen, just underneath the liver. Then we'll see the left ventricle, the left atrium, and the right atrium. So we can see here, can everybody see a nice, it still looks horn-shaped, right ventricle, then left ventricle, right atrium, and left atrium. To get an IVC view, we don't have a view here, but we would just rotate the probe with the probe marker pointing towards the patient's feet and scan over and look for the IVC as it flows into the right atrium. So those are our 4 views of point of care echo, looking at your parasternal long axis, your parasternal short axis, your apical floor, and your subxiphoid or subcostal window. Please email me if you have any questions.